Louise Irvine.
And what is your role?
I'm a GP in Lewisham, in North Lewisham, and I've been a GP there since 1995. I'm also a Programme Director for GP Specialist Training in Lewisham, and I'm also Chair of the same Lewisham Hospital Campaign.
I want to ask you first about your practice. Where is your practice?
I practice in New Cross, Deptford, which is in the north of Lewisham, in a practice called the Irvine practice.
And who are your patients?
We have about 7,500 patients, and there are people who live in the area in which I practice, which is in some of the most deprived wards in Lewisham, and Lewisham itself is one of the most deprived boroughs in England.
And how long have you worked as a GP in Lewisham?
As a GP, I've been a GP since 1988. I started working first in Lewisham in about 1990, and I've been a partner in my practice since 1995.
Why do you want to assist this inquiry?
As a GP, it matters to me the quality of care that my patients can access. Obviously, the parts that are within my control, which is within my practice, I try, along with my colleagues, to create as good a service as we possibly can for our patients. But we also depend on other services. We depend on services, hospital services, and community services. And therefore, it matters to me because every single day I'm dealing with patients and I'm trying to help them, help solve their problems. And some of those I can do within the context of our practice in primary care, but many times I need to link up with and use other services, refer patients into other services, etc. So the whole health economy has to work well for my patients to get a good service.
What are your main concerns about these proposals?
Many of the concerns have been expressed already. First of all, we have a very deprived population that actually have low income but also higher than average health needs. It's really important to them to access good care, and they do get good secondary care and community care from the Lewisham NHS Trust. In terms of journey times, it's just outrageous to suggest that it's just as easy or almost as easy for patients to access care beyond Lewisham. Many of my patients who use public transport, they can get to Lewisham Hospital in about 15 minutes. We've tested as part of the campaign the journey times to Queen Elizabeth A&E, and on 2 different occasions it's taken nearly 2 hours for people to get there by public transport. So that's one thing. I think if patients are admitted to hospital, because of course if A&E closes, we're talking about closing the acute medical, surgical and children's wards, then sick patients will be admitted to hospitals further away. It will be very hard for patients from my area to travel, to visit their relatives. It will cost them a lot more. It will probably reduce the amount of visiting. I think visiting is a really important thing for people to recover. We also have a very young population in my practice with a lot of women having babies. At the moment, they really value the maternity care they get at Lewisham. They do have choice. They can use the midwife bed unit, knowing it's co-located with an obstetric unit, or for the majority who are actually higher risk, they can go to a very good local obstetric unit. They won't have that care. They will have to go further away, Queen Elizabeth or King's or St Thomas's, and that will disrupt relationships that have been built up, care pathways, networks, and make it actually fragment the care that they get. And that leads on to the other thing about the whole, as GPs, we've been working in Lewisham, certainly formally for the last 8 years, as a sort of federation of GP practices. This predated clinical commissioning groups, and we've been working closely with Lewisham Hospital and with social community care, and built up relationships, networks, and knowledge about how all these things can work together well for the benefit of patients. And that's something I'm really concerned about. That's all going to be broken up if these proposals go through.
We've heard a lot about the process and the absence of process. What do you want to say about that?
About the consultation process? First of all, the public consultation was only 30 days, which is really short. Most people found it really difficult to complete the consultation documents because they were very dense. They didn't explicitly say that they were proposing a closure of Lewisham Hospital, A&E, and acute services, and Lewisham Hospital maternity. They hid the map that showed that they were going to sell 60% of Lewisham site was buried in the appendices, which most people in Lewisham didn't see. I went to one of the so-called consultation, the kind of, before the consultation process, they had these sort of workshops with clinicians, and I went to the community care one, because all of these, all the TSA's proposals are based on this notion that 30% of the hospital services will be replaced by community-based care. When I went to that, it wasn't possible to really express any dissent. When one person asked the leader of the workshop what was the evidence that community-based care could reduce the need for hospital care, the person who was asked was Dr. Penny Dash, who was a senior McKinsey's executive and a senior member of the King's Fund, and Dr. Penny Dash's reply to that question was, there is no hard evidence. So they're basing a whole strategy on something where they, even McKinsey's who were behind the whole consultation process, admits that there's no hard evidence. And whatever evidence there is, A, does not show that improved community-based care does reduce hospital admissions, although it might be a good thing in its own right, but it doesn't necessarily reduce admissions, nor does it reduce costs. But in the workshop we went to, we weren't really allowed to talk about specifics. In fact, Lewisham Hospital wasn't even mentioned. We just were asked to indulge in blue sky thinking and aspirations and visions. That was all we could talk about, aspirations and visions.
I want to ask now about the campaign, Save Lewisham Hospital Campaign. How has that developed?
That's been the most amazing experience. When we first heard that Lewisham was going to be included in the TSA proposals, which was sometime in September 2012, when I say we, I mean clinicians and patients and people who've been, people from Lewisham Pensioners Forum, for example, we all discussed this and said, this sounds dreadful, we need to do something about it. And we had a meeting of just 12 people, and we said, well, we're going to have a public meeting to tell people what's happening, and while we're at it, we should have a march to protest. So we penciled in the dates, we organised the public meeting. We thought it would be great to have it in the hospital. The hospital very kindly let us have the auditorium. It soon became clear that the auditorium was going to be far too small for a public meeting. Not only did the hospital have to provide 2 overflow venues in the hospital for the meeting, but we had to organise at short notice an entire other venue at the Calabash Club. And even that people couldn't get into. The public meeting had probably at least 600 people turned up. And these were ordinary Lewisham people from across the borough, from all walks of life, and also Lewisham staff. And the feelings of anger, kind of disbelief basically, and determination to fight it were huge. Then our demonstration, which we were liaising with the police, and originally it was thought there might be about 2,000 people, which we thought would be a good turnout. And we began to get the feeling from the streets, we were leafleting and having street stalls and talking to people, that a lot more people were going to come. So we said to the police, we think we better cater for 4,000. They said, no, don't worry, that's not going to happen. That doesn't happen in Lewisham. On the day, it was bucketing, windy, cold bucketing day in November, and I thought, oh dear. Well, we had 15,000 people on that demonstration. That built up to the Jeremy Hunt was going to announce his consultation, his decision at the end of January, and we organised a second demo in the snow, and it had 25,000 people on it. to understand, and we facilitated that. There were protests of mums and babies in buggies, mums and dads and babies in buggies in the snow, went to Department of Health to try to talk to Jeremy Hunt. He was in the building, he would not come down to talk to these 120 mothers and babies in the snow. He wouldn't come and talk to them. As well as that, we produced very detailed critique of the proposals as well. We, as a campaign, did a detailed analysis, but we also were overwhelmed by the contributions from the Lewisham clinicians. So each department produced amazingly detailed, evidence-based critiques of the proposals, from the emergency department to paediatrics to medicine to surgery to ENT to care the elderly and so on. And they're all on our website. We also had contributions from the churches, from the different dioceses. We had contributions from the Lewisham safeguarding team, from public health. So we had support from the council, support from our local MPs, and we had support from across the borough, from every possible part of it. And that's why we had such a huge impact.
And one final comment, because I'm being reminded of our time. As chair of this campaign, what has this campaign shown you as to the people of Lewisham?
What can this...
what does it show you? What does it reveal to you
about
the people of Lewisham?
What it reveals about the people of Lewisham is, A, they really value the NHS, and they're prepared to fight. They don't take things lying down. They are, I think they're prepared to show passion, but also intelligence. The whole level of critique we've had today and the evidence has been amazing. And I think people here are very determined. That's why, whatever happens, we're going to keep on fighting to get our hospital.
Says that in case the change is predominantly financial, he almost seems to admit that it's wholly financial, since no criticism of the standards of care and excellence that Lewisham Hospital is offering. So the financial motive, it's been commented on by a couple of people that Lewisham Hospital would be cheaper to close down than other hospitals lumbered with the PFI debt. But the other thing that hasn't really come up today, and perhaps you could help me with this, is, as I understand it, there's quite a lot of land that goes with Lewisham Hospital. Were it to shrink in size or to close altogether, there's a potential release and sale of that land. And I wondered whether you had any thoughts on whether that might be a motive behind some of the TSA thinking.
Yeah. Financially motivated plan, and the role of PFI has been totally in criticism is because the PFI has to be constantly fed, and you have to divert patients to the PFI hospitals to bring the money into the hospitals, and that means financially viable, good clinical hospitals like Lewisham are having to close to feed the beast of the PFI. And that also means, selling off land. They sold off 60% of the site, that would go to developers to develop, I don't know how they would do it, but it certainly would be used for healthcare. And that money that's to be made from that is supposed to go to help pay PFI debts of the neighbouring South London Healthcare Trust. But I think it's totally immoral to start with. It also doesn't make sense financially to close a financially viable hospital to help to sort out problems which were not caused by the hospital, and again, as Alison Pollock said, not even caused by the South London Trust, but caused by government policy. And if you look at the sums, you look at the costs of this whole reorganisation, it looks as if it's going to cost something like 196 million to do all the reorganisation and to rebuild some services in other hospitals. And that's only going to be saved about £19 million a year. So it will take 10 years to pay off the costs of what the money they're going to spend on this reorganisation of services across South East London, and we've even shown that those something wrong, it could take even longer than that. So it doesn't make sense financially. In fact, I don't know why they want to close the hospital. It just doesn't make sense.
Cancel the day.